We are going to discuss this preparation course for the communication skills station. Before we start, I'd like just everyone attend, just to introduce yourself or write your name in the chat, so I'll be able to know your name, and we will discuss. And by the way, I there is two of our colleagues has just send their apology for not attending because it will be so late for them. They are staying in India. So I will record also this session and try to share it. So kindly everyone, just share your name, write your name in the chat, so I will see it and we will able to discuss about it. Okay. And I'd like also to get confirm about the voice. Is it clear to all of you? Okay, so Dr. Isra. Okay, you are welcome. And the sound is clear, yeah? Okay, so, and we will start now. So this is the aim of the course that we are going to discuss today. We are trying to improve the skills of all the candidates who will join the course. This is actually a free session. It is to give you an overview about the course and also get you the chance, if you'd like, to practice and get a feedback also regarding your performance, and how to know the tricks of the exams and how to know how the exams of the station of your station will be marked. So this is the aim in general and the objectives that we are trying to do it, that each one of these learner will be able to perform the skills in an efficient way according to the GMC good clinical care criteria within the frame time of the exam, which will be 7 minutes for each session. This is the point. So the DOHNS in general, the OSCE exam, it's about 28 sessions with 3 rest station, and approximately about 21 to 22 will be non-manned stations. This is will be otology, rhinology, head and neck, and head and neck and rhinology. And about 6 to 7 stations will be a communication skills station, and this station will vary between history taking, which usually comes in 2 stations, and breaking bad news, obtaining consent, explanation, written communication skills, and examination, clinical examination. Sometimes the history taking station will come as a part, as a station, as an individual station, or it comes as joined with some clinical examination station. So this is in general about 6 to 7 stations, and this is the varieties between of them. So there are some general tips for all of the communication skills station. The first thing is read the instructions. You have to, in the exams it will be just rooms, and before you enter the room you will find the paper which where the question was written and the instruction. So it's very, very important to read the instruction to know what are you supposed to do and what the examiner needs to know. So sometimes if they will ask you to take a consent, so you have to take a consent. If they tell you explain this operation, so you have to explain this operation. So you have to read the instruction to know what is the situation. The second thing is to introduce yourself and check the patient identity by asking his name and date of birth, and this is the general points, and use Hangel in the clinical examination station. And actually my advice to you is to use the Hangel in all of your station. If you find it, just make it something constant, so you will avoid forgetting doing it, because of the stress of the exam. Sometimes you will forget to do this very, very important point, and avoid medical term. Try to express in a language which would be understandable, and try to use nonverbal skills. Nonverbal skills like the eye contact, showing empathy, try to change your voice tone, try to listen and nodding, all of these nonverbal skills. It's very, very important. You know, this station is a communication skills station. Okay. And beside you'll get a marks about your knowledge, your medical knowledge, you definitely get some points about your skills, how you are communicate with the patient. Are you communicating well or not? And establish patient understanding and explore expectations. It is very, very important not to over talk over the patient. Okay, you have to listen to him. You have to establish his understanding, his level of knowledge, and also explore his expectations. If there is any hidden agenda, if there is anything he's concerned about it and he would like to know more about, so you have to cover this point in your station. Keep professional and thank the patient. Okay, so when we are talking about the history taking station, you know, today I'll just give a point. Just I will not go in details of every station, but it just a general point that history taking may be combined with other stations. Sometimes it comes, okay, take a history. For example, take a history of this patient complaining of epistaxis and do anterior rhinoscopy and do flexible nasal laryngoscopy. So it is a combined stations. And actually the history taking station in this point will take about 30% of the mark, and about 70% will be on the other, or 40% and the 60% will be in the other points. So, or maybe it comes at the station. For example, take a history and discuss the differential diagnosis, or take a history of dizziness from the patient. So you have to practice. Okay, so I have to practice more and more, and by the time you will get the the ability to modulate your points of taking history. You will be able to take a history in 2 minutes. You will be able to take a history in 5 minutes, or you will take a history of 7 minutes, according to the priority. And you know what is the most priority point. Or I have to take a detailed history, present, illness, past medical history, drug history, social history, all of this. Or I will ask a pointed question to get the points of the history. So the systematic approach establish rapport between you and the patient, and ask about the age and the occupation. It is very, very important, because sometimes you will find a clue in his occupation, in his job, that related to his complaint. For example, if he has a stressful job, or for example, maybe it's related to some concerns or hidden agenda. If he's, for example, an actor and you are going to make a facial disfigurement, like a scar in the face or facial palsy, so you have to deal with these concerns, or to deal with this hidden agenda. And history of present illness and the past history, social history. I know all of you know these steps, as you are already graduated and all of you are practicing medicine. So it is not something new, but the point is you have to expose the idea and the concerns and expectations of the patient and cover this point. And surely you have to summarize. So the tips, you have 7 minutes. You should use it wisely. Okay. And start with open question followed by closed question. It is something very tricky, because if you don't follow this technique, you may be face an actor. You know, you will do this. It is not on a real patient. All of them will be an actor. So sometimes they will be so reluctant. Sometimes if you just ask closed question, they just answer yes no, and it is not a communication. So you have to ask an open question, a general question, open question, any question, how, what, why, any question like that. So you will let him to give him the chance to talk and say everything, and after that you will call the question. Active listening, it's very, very important. And non-verbal, don't overtalk. It's called verbal diarrhea. If you are just calling and talking and talking and talking and talking rapid, because you have already, most of us, even I'm not, the English is not my mother tongue language. Okay, so sometimes when you are trained for the exam, you we are trying uh, to read everything, and in the exam I'd like to say every point, regardless what's the condition of the patient. I'd like to cover the topic. So it is not this is actually a very, very bad, because it is a communication. Okay, so it is not just you have to say all of the points you have and let the patient talk with himself. So the summarize after each segment. Okay, this is will give you the ability to get what is the point you have already forgot to say. The signposting technique, and this is one of the technique also beside the open and the closed question that we are trying to train in the course about how to do it. And this is one of the defects of us, is signposting is how to go from the present illness to the past history smoothly. Okay, and how to change the questions in a smooth manner. It will not goes like question and answer, question and close the question, close the question. It will give the discussion sometimes. For example, if we are to, after I take the medical the present illness, okay, I will summarize it with the patient, and I will say to him, okay, so I'd like just to tell you, ask you something about your health. How do you feel? Do you have any general? Do you have any medical illness like high blood pressure? So you are just first give him an introduction that you are going to talk to him about something else. So this is the technique. So, and this technique needs to be trained. We need to do it frequent time, so we will be able to do it in a perfect way, and approach in a non-judgmental way, especially in the social history. Explore the hidden agenda and anything you are worried about it. Okay. So this is a part of the hidden agenda, and the hidden agenda is something you should explore it when you are taking history. And this is just an example. For example, any patient complaining of epistaxis, one of the hidden agenda will be a tumor. Okay, or in the pediatrics, it will be leukemia. If the patient has a facial palsy, or may, for example, undergo an operation that will one of the complications, the facial paralysis. So this is will be a loss of his job. It will be a hidden agenda. Neck lump, he was thought about cancer, even if it is just an reflux, and he has a feeling of lump in his neck, but he will thought that maybe I have a cancer. So you have to cover this point, even if the patient try to give the patient the chance to talk about it, and even if he not talking about it, try to explore it and try to cover it. Okay, skin incision, job, and vertigo or tinnitus about brain tumor. So this is an example of the hidden agenda, and this hidden agenda should be covered. And you will not wait for the patient to say it. You have to cover it by the way. This is just an example of the history station, and this is one of the most common station that comes in the exam: epistaxis, lump in the throat, hearing loss in the adult, olfactory dysfunction, unilateral tonsillar swelling, dizziness, hoarseness of voice. So this is just an example. There is a lot of stations, and there's many books containing all of the topics. Uh, the second part is about the breaking bad news, and again, I have talked about the first thing is you have to read the instruction. So in the breaking bad news, you have to read the question well and use it in any available diagram or image. And this is also something you will forget it, especially if you feel stressful in the exam. Usually you will find a diagram, like a diagram or a picture of a radiology image. So you have to use it. Okay, even if they are not saying use this diagram, you have to use it, and if you will not use it, you will lose a mark. And invite relatives to attend in the breaking bad news. And also you have to know the patient situation, the patient perception about it. And when you are going to give the bad news, you have to give it in a simplified manner, okay, in a simple terminology, giving it with with an empathy, and try to use a non-verbal skills for the support. This station, breaking bad news, it is not about you are going to explain the situation. It is different from giving explanation, okay. You have to explain, but you just give an overview of all, for example, of all of the line of the treatments, of the condition. You will not go in details, in more details. The most important point in this station is how you are going to support the patient regarding this bad news. How you are going to give him this bad news in something easy, or something let him to understand that, his condition, and know what is the way forward. So you have to address the emotion and empathy, check understanding, provide structured plan, and also offer to speak to the family on behalf of the patient and arrange a follow-up. There is a lot of points, and actually, when you are going to the exam, also you will be marked by something like that. If you do it well, you will get a mark. If you forgot, you will lose a marks. So it is just you are accumulating and you are collecting marks in each station. And the more marks you collect, the more the chance for you to pass from the exam. So this is actually an approach also to breaking bad news station. It's about to introduce yourself and establish consent to talk, and try to check the identity and explain the invitation. If it is a cancer patient, so you have to call the specialist nurse, and this is something in UK that deal with the oncology cases, so you have to call it. And also is um, establish patient knowledge and deliver the bad news preceded by a warning shot. So when you are going to tell him something, you have to give something, for example, like, I'm sorry, I don't have a good news to you today. So you have to give him a warning shot before you tell him about something bad. And this is the technique. So definitely you have to know how to manage in an empathetic statement. And you will deal with an actor, and these actors know how to do it well, and know how to be a reluctant, or how to be an offensive, or how to ignore, or deal with anything that, like, ignoring, or say no, I don't have a problem, it is just something, your result is not correct. So you have to deal with it, and you have to deal, for example, with the questions you will be asked, like, how long have I got to live? If the patient going to blame himself about something, about his habit, like if the patient is smoking and he has a cancer larynx, so maybe he will get blamed himself and say it is because of the smoking. I'm the guilty of doing so. How you are going to support him? How you are going to manage this point? And what about my job? Okay, all of this question, you should know how to deal with it, and you should to know how to answer it. And this is the point of the breaking bad news. Yes, definitely you will give a structured plan, and this structured plan will be based on your medical knowledge and your ability to change the medical terminology in a simple manner, and in a simple word to talk with you. And the last thing is the conclusion, how to summarize it and ensure understanding, and offer to speak a family and follow up. Okay, so this is regarding breaking bad news, and this is examples of the most common cases: laryngeal carcinoma, T1A or T3, and this is and I repeat it again: read the instruction and read the paper well. If they say T1A, and this patient with T1A cancer, or say this patient with T3 cancer, so according to the stage, you are going to give a structured plan. If this structured plan will be a radiotherapy, will be a laser chordectomy, will be a total laryngectomy, will be a combined radio chemotherapy, according to the results, according to the what you read. So if they say that T1A, and when you are going to talk about the lines of treatments, and you say, okay, we can give him a chemotherapy, or say, well, we are going to give to do a total laryngectomy. So this is definitely a wrong answer, and you are saying something wrong. And the other case, acoustic neuroma, or sensory neural hearing loss in a child, or cholesteatoma in a child, or anosmia in a child, or recurrent cancer. This is a patient coming with a cancer and a palliative case. How you're going to deal with this palliative case? Someone will not do anything, just support and give him a painkiller and support him, support his airway, support his feeding till he has a metastasis and everything. So this is an example of the breaking bad news. The third station is about the consent, and the consent is something very, very important. There is a steps of obtaining a consent. Start by the introduction, introduction in the normal introduction. Introduce yourself and obtain the consent. Explain the invitation. Tell the patient, check the patient identity. Sorry, and tell the patient that we are coming today to obtain a consent for regarding a procedure that you have been recommended, called, for example, parotoidectomy, or micro or myringoplasty. Okay, so this is the introduction and the plan of the discussion. You will assess the patient understanding, assess his knowledge about the procedure. If anyone has talked to him, what is his information? What did he know about it? What is he concerned about it? And explain this diagnosis and the procedure indication, why we are going to do it. And the most important is, when you are talking and when you are, it is just something general in all of the station, you have to give him a small chance. So when you are giving him something, you have to stop and check understanding. Okay, so when you are going to check the understanding, you will know if there is any problem. Okay, so you will continue and the patient will not lose you. And explain the procedure, about the skin cuts, about post-operative care, the benefits and risks and the alternative. Okay, and stop and check the understanding. Okay, and after that you will talk about the procedure itself, the instruction. I mean, hospital stay, you stay for an overnight, for 2 nights, and the time of work, and if there is any instruction like the date of the suture removal or something like that. And after that, you have to summarize and the closing. And when you are closing this station, you will have to tell him again that you can change your mind at any time, and signing the consent doesn't mean that you have to undergo the procedure. It's the patient right to change his decision, and it's the patient right to change his opinion at any time. Okay, so this is regarding the consent. This is an examples of the consent station. The head and neck, superficial parotoidectomy, hemithyroidectomy, submandibular thyroidectomy, and rhinology, otology, laryngoplasty. And this is just an example. But I'd like you to tell you something that sometimes it will not come frankly say, okay, obtain a consent of hemithyroidectomy or obtain a consent of superficial parotoidectomy. It will come as a case, and that's why I'm going to in the practice showing you some examples of how it comes in the exam. So, for example, he will say about the superficial part. This patient has a parotid lump, and we do an FNA, and FNA showing something pleomorphic adenoma. So discuss, obtain a consent from him regarding the procedure he should do it. Okay, so you are assumed that this procedure will be superficial parotoidectomy. It will be easy. It will not be a difficult question, but I'm just let you to know the importance of read the instruction well, and because they will not just say take the consent of something, like they will just give you a case. The last point is about giving explanation. Giving explanation, it is something. Uh, there is some overlap between giving explanation and breaking bad news. And one of the common mistake when you are giving a breaking bad news station, you change it in giving explanation, so you will ignore the patient concerns. And sorry for talking about, but this is very very important, because I've seen it with many of your colleagues who attend this course in the last day. They are aware about the knowledge that they will should give it to the patient, and ignore the patient concerns and the problem. So the giving explanation is something different. You have to explain everything. And the point of giving explanation is about the introduction. This is something constant in all the station. It is information gathering. You will gather the information from the patient, know his level of knowledge, how is know about this condition, any idea, any concerns, any expectations. Then information giving, so you are gathering the information, then giving an information. And in this information, if you find the diagram in the station, again use it. If you don't find a diagram, try to know how to draw it. For example, if there is giving an explanation of benign paroxysmal positional vertigo, and you have a paper with you, try to draw the inner ear and the semicircular canal. And when you are going to explain to the patient, it will be easier to you to let him to know that the crystals or the fluids, or how it is the pathology and the treatment options. And the last things, after giving him everything and check his understanding, you have to summarize, give him the key points, the last key points, and provide him any further information. If there is a website, you are going to share it with a patient leaflet or something like that, and close and provide a contact for the patient. So this is an examples of the giving explanation, which is a benign paroxysmal position vertigo and epistaxis and otitis media with effusion. This is otitis media with effusion maybe comes as an explanation, maybe comes as a consent of myringotomy, according to the situation. In both cases, you should know how to explain the situation to him. Okay, so this is a part of the communication skills station. Okay, the remaining part is two part, which is the clinical examination, okay, and the written communication skills. The written communication skills, which include the discharge form, the operative notes, and the transfer letter. And you should know how to write it in 7 minutes, okay, because and you should train on it very, very, very frequent, because you will face a problem with the time to write it. Okay, so I'd like just to show you something also about the notes that will be provided in this course. We have different notes that will assist all of you in studying study notes, and know how to be trained well, and avoiding any mistakes as soon as possible. I will just show it to you, and after that I will, anyone has a question you'd like to ask me about it, and if you are willing to practice, okay, it's okay, or we can make a practice in another session. So this is actually the notes, the study notes. This is a consent notes. This consent I have said about this introduction, this something constant for all of the station, how you are going to take it and how you are going to obtain the consent. And after that, we are taking each procedure as an individual, about the point of the diagnosis, the procedure, the benefits, the risks, alternative, and instruction, how to say it, and all of the cases that could come in the exam, and you are trying to do it. And this is the explanation, and the explanation also the points that I have said about the steps, information gathering and giving, and summarizing the closure. And the most common topic is about benign paroxysmal positional vertigo, how you are going to explain it in a simple way, and giving to the patient. The history taking, this is the point that I have stated about, different from just dividing history. The red flags in each station, how you are going to know the red flags, and these red flags is very, very important, and you shouldn't miss it in the history taking, because if you miss it in the patient, that's mean that you will miss a cancer or miss a big problem, and this is actually, I don't think it is something acceptable in our practice to forget something like a cancer. So I'm just said about the red flags and also the other points, so you'll be able to be trained well on these points and try to. It's about 19 topic of the history station, and the last one is about the breaking bad news, and also about the technique, how to use the spikes technique, and also giving the introduction and establish and summarize, and some tips about how to give a warning shot before delivering a bad news, and after that how to answer this patient question, and dealing with each topic, how to say about the treatment options in a simple manner, in a simple way, with avoiding the medical term, so that recurrent cancer, the unilateral sensory neural hearing loss, the steatoma, and the caustic neuroma, and also the anosmia and chips. So it's just to assist you in how to deal with this station and how to deal with it. Okay. So by the way, now I am just finished the session for explanation. I'd like to get any question, if anything you'd like to ask me about it. It's okay. Regarding, if you'd like to ask using the mic, or if you'd like to write the chat on the chat, so I'll be able to answer about any question. Okay, thank you.